Okay, epistaxis or nose bleeding is included in hematology. What's the cause of a nosebleed? It can be from trauma, from a foreign body, from nose picking, inflammation, allergies, upper respiratory infections. Some kids just have vessels that are much closer to the surface in the mucous membrane of the nose. And if they dry out a lot, maybe they're allergy kids or the air is very dry, they're more prone to nosebleeds. Nosebleeds are usually self-limited. We want to encourage the parent or whatever adult is present to remain calm. Now, you have always probably heard when someone has a nosebleed, lean them back. But I want you to think about that. Nose is bleeding. If I lean back, I can't see the blood anymore, so it must have stopped, right? No. So what's happened? They're probably just swallowing it. So you want to have them lean forward because we want to see what's coming out first of all, but also we don't want them to swallow that blood. It's going to make them throw up. So we want to have them lean forward and apply firm, continuous pressure with the thumb and forefinger for at least 10 minutes. And it needs to be pretty hard, a pretty hard squeeze, hard enough to hurt a little bit. Okay. After the bleeding has stopped, they need to not blow or clean their nose for a while afterward to let that tissue heal. Okay. If the bleeding persists, they can insert cotton or a tissue and apply cold. Just something to put pressure from the inside, and cold can vasoconstrict somewhat. Severe bleeding or recurrent nosebleeds need to be evaluated by a healthcare provider. If a patient has severe persistent bleeding, they may end up in the ER. Sometimes they will use epinephrine soaked gauze. If a patient has recurrent nosebleeds and any underlying disease is ruled out, they decided it's just they're just prone to nosebleeds, humidifying the air, keeping the inside of the nares moisturized, and discouraging nose picking helps decrease the number of nosebleeds. A lot of that has to do with dry, irritated tissue. So keeping that air humidified and the inside of their nose moisturized helps. Okay, next we're going to talk about hemophilia.